Welcome back to another video with Sports Massage Therapy Education. Today we're going to be looking at the shoulder joint and specifically looking at the bony landmarks and the ligaments. But we can't just look at the shoulder itself, we have to look at the whole shoulder girdle. So starting from an anterior point of view, the first thing we want to look at, just in here where that sternum is, we have what they call the manubrium. And I'm going to try my best here to outline this for you guys. So the manubrium is going to make up a series of joints. So, manubrium being here, what you're going to have, feeling with your client, if you feel that collarbone, so the clavicle, that's actually going to come all the way down and attach just onto the top. So what this is going to form is the sternoclavicular joint, so where the sternum meets the clavicle, okay? Following that all the way up now, and I'll demonstrate on this side. If you're feeling the front of the shoulder, you have this kind of like bony landmark. This is going to be what we call the acromion, okay? So again, you can have obviously one on each side. This is now, if you're following that collarbone all the way up, it's going to be what forms the acromioclavicular joint, where that acromion meets the clavicle. Last thing I want to point out is with this acromion, if you follow it across ever so slightly, and again, you can use the clavicle as a landmark here. So following this all the way up, so just in here, so we've got the acromion here, the clavicle's coming up here, just on the inside is going to be what we call the coracoid process. So that's going to sit roughly around here. So the coracoid process there, the acromion here, and then obviously you've got your clavicle coming across. Reason understanding these is extremely important is because a lot of these are actually going to be associated with your posture. So you're going to find you're going to get a lot of people come in who are going to have slouching, so that kind of like that kyphosis. The coracoid process, the reason this one's particularly important, if we can find that, is this is what the pec minor attaches onto. Pec minor being one of the muscles that if it's tight, so if you kind of picture this now, if this becomes tight, that's going to pull those shoulders forward. Whereas if we can stretch that out, it's going to bring it back. But because obviously it's attached onto that coracoid process, which is actually part of the scapula, it's going to pull that forward, which is where you get that kyphosis from. Okay, looking from a posterior point of view now, obviously what we've got here is the scapula. So again, I'm going to try my best. We're going to try and outline this as best we can, but I am no artist. So we have the scapula sitting just around here. Again, we need to be able to understand the structure of the scapula itself. So at the very top, you're going to have what we call the superior angle of the scapula. At the bottom, that is now going to be your inferior angle of the scapula. Just in the middle here, this whole border, it's what we call the medial border of the scapula. And obviously just overside on the lateral, you guessed it, the lateral border of the scapula. Some of the key things is being able to find what we call the spine of the scapula now. So the spine, just through here, the spine of the scapula is going to sit just over here. And what this does is the other side of this is what forms the acromion. So what we just pointed out on the front is actually the spine of the scapula as it comes anterior. On that as well is also going to be that coracoid process, which as we mentioned, if those muscles become tight, all of a sudden it now pulls that shoulder blade forward, which is where you then get that kyphosis. Okay, so we're going to look at some of the ligaments on the front now. So obviously it's manubrium in the middle and obviously the clavicle just coming over here. So the first one's what we call the interclavicular ligaments. It sits just on the top of this manubrium up here, and it actually connects just onto the top of each of those clavicles there. What you're also going to have just underneath this clavicle, you've actually got your first rib comes off of that manubrium, and obviously the costal muscle sitting just between. Connecting that first rib and just attaching onto that clavicle is going to be the coracoacromial ligament there. And then you've also got the sternoclavicular ligament. So again, the sternum just attaching onto that clavicle, which is obviously going to be there, acting as like a type of scaffolding to obviously support that joint to prevent that clavicle from popping out. Okay, so looking at the ligaments over on this side of the shoulder now, one of the ones I want to go through first, this is what we call the acromioclavicular. So where we've got the acromion, obviously onto the clavicle, the ligament is going to attach the two together. But another one we've got from the acromion, but going down onto that coracoid process, is the coracoacromial ligament now. So these ones are going to run and support just across here. And the other one you've got from here, just on this coracoid process now, is the coracoaclavicular ligament. So this one is going to be what connects that coracoid process onto the clavicle itself. And just to wrap today's video up, we're actually going to just finalize now with the actual shoulder itself. So this is what we call the glenohumeral joint. So the glenoid cavity being the socket, and the humerals, coming from the term humerus, is going to be where the humerus slots into that socket, because it is a synovial ball and socket joint where the humerus and the glenoid cavity meet, making the glenohumeral joint. And that, ladies and gentlemen, is going to be a wrap on today's video. So I hope you've enjoyed it. If you have, hit that like button, comment below what you want to see next, and don't forget to hit that subscribe button because it does help support the channel. And as always, I will see you in the next one.